That tingling in your feet at night that will not let you sleep, that burning sensation in your hands that comes and goes without warning, that numbness that makes part of your body feel like it does not quite belong to you anymore. If any of that sounds familiar, you have probably been told the same thing most older adults get told. It is just part of getting older. Your body is aging. Learn to live with it. I want to challenge that today. Because in the vast majority of cases, those symptoms are not simply the inevitable result of age. They are signals. Your nervous system trying to tell you that something specific is attacking it. And in many cases, the things doing the attacking are sitting right in your medicine cabinet, on your dinner table, and in habits so familiar you stopped seeing them as a threat years ago. I am Wesley Harper, and today we are going deep on nerve damage and neuropathy after 60. What is actually causing it? Why older adults are so much more vulnerable than younger people. The specific medications, daily habits, and environmental factors that are quietly destroying nerve tissue, and what you can do starting today to protect the nervous system you still have and give damaged nerves the best possible chance to recover. Stay with me because some of what I share today is going to completely change how you look at your daily routine. And one of the causes we are going to discuss is something that affects millions of older adults who have no idea it is contributing to their nerve symptoms every single day. Before we get into it, drop a comment right now and tell me honestly, do you experience tingling, burning, or numbness in your feet or hands? Just yes or no. And if you feel comfortable, add how long it has been going on. You will be surprised how many people in this community are dealing with the exact same thing in silence. Now, before we talk about what is causing nerve damage, I want to make sure you understand what is actually happening inside your body when nerves are being damaged, because once you understand the mechanism, everything else becomes clear. Your nervous system is essentially the communication network of your entire body. Every movement you make, every sensation you feel, every automatic function your body performs without you consciously thinking about it, all of it depends on signals traveling through nerves at extraordinary speed. These nerves are not bare wires. They are insulated. Each nerve fiber is wrapped in a protective coating called the myelin sheath. This coating is essential for electrical signals to travel quickly and accurately. Without it, signals slow down, get scrambled, or fail to reach their destination entirely. Neuropathy is what happens when this system breaks down. When the myelin sheath wears away, or when the nerve fiber itself gets damaged, those signals start failing. Tingling and burning are the sensations of a nerve sending scrambled signals. Numbness is a nerve that has stopped sending signals properly at all. Weakness in the legs is motor nerve damage affecting muscle control. Loss of balance is damage to the nerves that tell your brain where your body is in space. And here is the part that most people never fully appreciate. These symptoms do not just cause discomfort. They take things away. The confidence to walk on uneven ground, the ability to feel the floor properly under your feet, the independence that comes from moving through the world safely. Neuropathy left unaddressed does not stay the same. It progresses, and the time to address it is before the damage becomes permanent. Now let us talk about what is causing it. Starting with the place most people would least expect, your medicine cabinet. Most older adults take multiple medications every day, and most of those medications were prescribed with genuine intention to help. But certain medications, particularly when taken long-term, can be directly harmful to the nervous system. And after 60, this risk is significantly higher than it was at 40 or 50 for a very specific reason. As we age, the kidneys and liver, the body's two main filtration and processing organs, work more slowly than they did when we were younger. This means medications are eliminated from the body more slowly. They accumulate at higher levels. Doses that were appropriate at 50 can reach concentrations that are toxic to nerve tissue at 70 or 75. This is not a dramatic sudden effect. It is a slow accumulation happening over months and years of consistent use. The first group of medications worth understanding is one that many older adults dealing with nerve pain will recognize because it is commonly prescribed for exactly that reason. Gabapentin and pregabalin. These medications are widely used for nerve pain, anxiety, and sleep problems. They work by quieting overactive nerve signaling, which initially makes them feel helpful for pain. But research is raising genuine concerns about their long-term use, especially in older adults. These drugs quiet nerve activity broadly, not selectively. The intended effect is on the nerves causing pain, but the same quieting effect spreads throughout the nervous system, including the brain. Long-term users frequently describe memory problems, mental fog, and difficulty concentrating that develop gradually and get attributed to aging rather than medication. Studies have found associations between prolonged use of these medications and increased risk of cognitive decline. They also cause dizziness and balance problems in many older adults, which significantly increases fall risk. A medication prescribed to help with nerve pain can over time contribute to further nerve and brain function changes, while also putting the person at risk of falls that cause serious injuries. The second group affects an enormous number of older adults and carries risks that are frequently underestimated by both patients and prescribers. Benzodiazepines and sleeping medications. Diazepam, lorazepam, alprazolam, zolpidem. These are among the most commonly prescribed medications for anxiety and insomnia in older adults. They work in the short term by broadly reducing nervous system activity, which creates a feeling of calm and helps sleep come more easily. The problem is the longer-term picture. These medications take significantly longer to be processed and eliminated from an older body than from a younger one. Each dose lingers. The effects accumulate. The result is a state of chronic low-level sedation that affects memory, coordination, reaction time, and mental clarity. Many older adults and their families attribute this gradual cognitive dulling to dementia or normal aging, when it is actually a pharmacological effect of the medication they are taking every day. Falls are one of the most serious practical consequences. Research has found that benzodiazepine use increases fall risk in older adults by 40 to 50% because of the effects on coordination and reaction time. A fall in an older adult is not a minor setback. It can mean fractures, hospitalization, surgery, and a chain of complications that significantly reduces independence and quality of life. There is also the issue of dependence. These medications create physical dependence relatively quickly. The body adapts to their presence, and when they are reduced, the withdrawal creates symptoms including heightened anxiety and insomnia that feel identical to the original problem. This creates a cycle where the person believes they need the medication when in reality the medication has created the very state it claimed to treat. The third medication category that concerns nerve and brain health specifically is a group that includes certain antidepressants and certain common antihistamines. Older antidepressants like amitriptyline, often prescribed for pain management or sleep, share with certain antihistamines including diphenhydramine, found in many over-the-counter sleep aids and allergy medications, a mechanism called anticholinergic activity. The cholinergic system is essential for memory, learning, and cognitive function. Medications with strong anticholinergic activity essentially slow this system down. The familiar side effects are dry mouth and blurred vision, but the less visible effects on memory, thinking speed, and long-term brain health are considerably more concerning. Multiple studies have found significant associations between long-term use of highly anticholinergic medications and increased dementia risk. The troubling thing is that these are often taken casually, a sleep aid here, an allergy tablet there, without any awareness of their cumulative effect on brain and nerve health over time. There are also certain antibiotics and other medications worth being aware of. Metronidazole and nitrofurantoin, for example, can cause peripheral neuropathy when used for extended periods. Certain heart medications, including amiodarone, have neurotoxic effects with long-term use. I want to be very clear about what this information is for. It is not to make you panic or stop your medications. Please do not do that. It is to give you the knowledge to have a better and more specific conversation with your doctor. The goal is always to take the most appropriate medication at the lowest effective dose for the shortest appropriate time while being monitored for the effects that can accumulate over time in an older body. Now let us move to the second category of nerve damage drivers, the ones that live in your daily habits. Sugar is the most widespread and most damaging dietary threat to nerve health in older adults, and you do not need a diabetes diagnosis for this to affect you. When blood sugar is consistently elevated, the excess sugar molecules bind to proteins and fats throughout the body in a process called glycation. In the nervous system, this process gradually damages the myelin sheath. The protective coating around nerve fibers degrades. The nerve loses its insulation. Signals begin to fail. This is exactly how diabetic neuropathy develops, and it is the most common complication of poorly controlled diabetes, affecting nearly half of all long-term diabetic patients. The damage tends to begin in the longest nerves first, the ones reaching the feet and toes. This is why tingling and numbness typically start there before progressing upward toward the knees and eventually the hands. It is a slow, steady process that can go on for years before symptoms become obvious. By the time the symptoms are undeniable, a significant amount of nerve damage has already accumulated. But elevated blood sugar is not the only dietary threat. A diet consistently high in sugar and refined carbohydrates creates chronic low-level inflammation throughout the body, even in people who are not diabetic. That inflammation is its own direct threat to nerve tissue over time. It is a slower and quieter version of the same process. Alcohol is the second dietary factor worth understanding clearly and honestly. Alcohol is a direct neurotoxin. This is not a strong opinion. It is established biochemistry. When consumed regularly, alcohol and its metabolic byproducts damage the membranes of nerve cells and disrupt their ability to communicate. This alone can cause peripheral neuropathy over time, but alcohol's effect on nerve health goes further through its impact on nutrition. Chronic alcohol consumption depletes the body's reserves of thiamine, which is vitamin B1. Thiamine is essential fuel for nerve cells. Without adequate thiamine, nerves literally run out of the energy they need to function and survive. The resulting neuropathy causes burning pain, weakness, and loss of reflexes in the hands and feet. This can develop in people who drink moderate amounts regularly over years, not just in people with severe alcohol dependence. The third daily habit category affecting nerve health is something that is not about what you consume, but about what is missing from your body. Nutritional deficiencies. Your nerves require specific nutrients to maintain their structure and function. When these are consistently inadequate over months and years, nerve tissue degrades. Vitamin B12 is perhaps the most important nutrient for nerve health, and B12 deficiency is remarkably common in older adults. After 60, the stomach produces less of a substance needed to absorb B12 from food. Many common medications, including the acid reflux drugs we discussed earlier, further reduce B12 absorption. The result is that a large number of older adults have B12 levels that are too low to maintain healthy myelin sheaths around their nerve fibers. The symptoms of B12 deficiency, including tingling in the hands and feet, balance problems, and cognitive fogginess, are frequently attributed to aging rather than to a correctable deficiency. Thiamine, B6, and folate are also essential for nerve health and are commonly inadequate in older adults who eat processed or low-variety diets. Magnesium plays a critical role in calming an overexcited nervous system and is depleted by many common medications, including diuretics and acid reflux medications. The fourth daily habit damaging to nerve health is one that affects nearly every older adult to some degree. Physical inactivity. Your nerves need blood flow to receive the oxygen and nutrients they require to stay healthy. Movement is the primary driver of circulation to the extremities. The nerves in your feet and legs depend on active, healthy circulation to receive what they need. When you sit for most of the day, that circulation slows. The nerves in the legs and feet receive less blood flow. Over time, without the stimulus of regular movement, the nerve fibers begin to atrophy from neglect rather than from chemical attack. They simply do not receive enough of what they need to maintain themselves. Exercise also stimulates the production of nerve growth factors. These are biological substances your body produces that support nerve repair and maintenance. A sedentary lifestyle deprives the nervous system of this repair stimulus day after day. Movement is not just good for your heart and weight, it is essential medicine for your nerves. Now let us talk about the third category: environmental factors that accumulate silently over a lifetime. Heavy metals, lead, mercury, aluminum, and arsenic are the main concerns. These substances accumulate in body tissue over decades, and the nervous system is one of their primary sites of accumulation. Lead exposure through old paint in houses built before the 1970s, through old plumbing, or through contaminated soil has been linked to neuropathy, memory problems, and cognitive decline. People who lived in older homes for decades carry lead burdens in their tissues that were never measured or addressed. Mercury accumulates primarily through consuming large predatory fish, tuna, especially the larger varieties, swordfish, shark. These fish sit at the top of the food chain and concentrate mercury from all the smaller fish they eat over a lifetime. Regular consumption over years builds up mercury levels in human tissue, including brain and nerve tissue. Mercury is directly toxic to nerve cells and causes tremors, coordination problems, and peripheral neuropathy. Arsenic exposure happens primarily through contaminated drinking water and through rice, which absorbs arsenic from the soil more readily than most other crops. Chronic low-level arsenic exposure is a documented cause of painful peripheral neuropathy. The cumulative effect of multiple heavy metal exposures over decades of life is something that standard medical checkups almost never assess, and yet it represents a genuine background contributor to the nerve symptoms many older adults experience. Now let me give you something practical, a clear framework for what you can actually do with all of this information. The first and most important step regarding medications is to schedule a dedicated appointment with your doctor specifically to review your medication list, not your next regular checkup where 15 things get discussed in 15 minutes. An appointment specifically for medication review. Bring every prescription, every supplement, every over-the-counter medication you take. Go through each one and ask directly, is this medication still the right choice for me at my current age and health status? Are there alternatives with less neurological risk? Is the dose still appropriate given how my body processes medications now versus 10 years ago? The goal is not to stop medications. It is to make sure that everything you are taking is genuinely necessary and is not accumulating to levels that are quietly causing harm. For nutrition, the most direct things you can do for your nervous system are reducing sugar and refined carbohydrates consistently, eating foods rich in B vitamins, including quality proteins, eggs, leafy greens, small fish like sardines, and legumes, asking your doctor to check your B12 level specifically, and staying consistently hydrated throughout the day. For movement, any consistent daily activity that gets your circulation moving to your extremities is valuable. A daily 30-minute walk is one of the most studied and most effective interventions for neuropathy symptoms. Gentle movement in water removes the joint stress that can make land-based exercise difficult for some older adults. Tai Chi has specific research supporting its benefits for balance and nerve coordination in older adults. The goal is consistent daily movement, not intensity. For reducing environmental toxic load, filter your drinking water to reduce heavy metal content. Replace old scratched non-stick cookware with stainless steel or cast iron. Limit large fish consumption to occasional meals while eating smaller fish like sardines and mackerel more regularly. Open windows daily to reduce indoor air pollution from building materials and household products. These are not dramatic interventions, but together they meaningfully reduce the total toxic burden your nervous system carries. I also want to speak to something that I think matters as much as any specific intervention. Recognizing your symptoms as signals worth taking seriously rather than just aging. Tingling, burning, and numbness in the feet or hands are not simply what getting older feels like. Balance problems and muscle weakness that is progressing are not inevitable. Brain fog, memory changes, and difficulty concentrating that have developed gradually over the past year or two are worth investigating rather than accepting. These are symptoms. Symptoms have causes. Causes can be identified. And in many cases, once the causes are identified and addressed, the symptoms can improve or at least stop progressing. The nervous system has more capacity to repair itself than most people realize. It is not as fast or as dramatic as other types of healing, but when you remove the things that are attacking it and provide what it needs to maintain and repair itself, improvement is genuinely possible. The people who continue to progress towards serious disability are often the ones who accepted the early symptoms as inevitable aging and never looked for what was driving them. You now have a very different picture. You know what the main drivers are. You know what questions to ask. You know what habits to build and which ones to reduce. And you know that what is happening in your nervous system right now is not something you have to passively accept. If today's video helped you, please give it a thumbs up and share it with someone you know who has been dealing with neuropathy symptoms and has been told there is nothing they can do about it. That conversation might genuinely change their direction. Subscribe if you are not already part of this community. Every week I bring you honest, practical health information built specifically for adults over 60, and leave a comment below. Which part of today's video hit closest to home for you? Your answer helps me understand what this community needs most, and I read every single one. Take good care of yourself. Your nervous system has been working for you your entire life. Give it everything it needs to keep doing that. I will see you in the next one. Just remember, this video is for educational and informational purposes only. Always talk to your doctor or healthcare provider before making any changes to your medications, supplements, diet, or health routine.